Good afternoon. I'm Dr. Shweta Goswami, Associate Director, Department of Infertility and IVF at Cloudnine Hospital, Noida. Today I'm here to talk a little bit about the role of AMH and as such the egg reserve on fertility. So with women now planning to conceive a little later in life, it has become all the more important as to what is our ovarian reserve in AMH. Science has and technology has really developed so much that a lot of our problems in terms of low sperm counts, tubal factors have been taken care of. One of the most rate limiting steps that we are still struggling with is how to overcome the problem of poor egg quality, and that is why the AMH as a blood test or the ovarian reserve testing has become a very, very important tool in our armamentarium of determining as to what are your chances of conceiving with fertility. So I'm going to start with a few questions that we have received here in terms of women asking us that as to what is the role of AMH, and I hope to clear some doubts regarding it basis the questions. So Meena asks that, can I get pregnant if I have an AMH of 1.29? Now it's a good question. What I would want to first of all explain is what is AMH or what is Anti-Mullerian hormone. Now Anti-Mullerian hormone is a hormone that is secreted by the follicles of the ovary in response to how are the hormones and what is the egg level of status in the ovaries. So therefore the optimal range of AMH or the anti-Mullerian hormone that we talk about for a female is between 2 to 3.5 nanogram per ml. The extremes of both ranges are not good. So if the AMH starts to go low, it's basically a function of how many follicles are there in the ovary, because each follicle will be producing some amount of anti-Mullerian hormone. And therefore, if we have low number of follicles, then the AMH tends to be low, and vice versa. If the AMH is very high, it tells that there are lots of small, what we call preantral follicles in the ovary that are contributing to a high AMH. So our optimal AMH is between 2 to 3.5 nanogram per ml. Once it starts to go down less than 2 nanogram per ml, it's a sign that a little bit of decreased ovarian reserve has started in the ovary. If it is higher than 4.5, it is usually denoting a hormonal imbalance known as polycystic ovaries. The problem of both the extremes are different. The reason of infertility in both of them are different, and that is why we have to tackle them differently. The management also is different. So if the question is that, can I get pregnant if I have an AMH of 1.29? Yes. Very importantly, there is no AMH level where we can say that at beyond this AMH level, you just cannot conceive. So yes, the AMH is lower. Like I said, the 2 is our lower threshold. So the minute it is less than 2, yes, it is a little concerning for us because it tells us that the egg reserve is going down. So as we understand, when a girl is born, there are a finite number of eggs in our ovaries. They remain kind of constant till our late 20s or early 30s, and then the fall begins. So this 1.29 AMH is telling us that there is a fall that's happening. Once we are left with even a fewer number of follicles, that's when less than 1000 follicles in the ovary is when we say that it's about menopause that we are entering into. So till we actually hit the very extreme of kind of undetectable AMH or a test called the FSH, the follicle stimulating hormone, where it starts to rise, till then we say that yes, we're into the entity of decreased ovarian reserve and not at a place where we've gone into ovarian failure. So the AMH of 1.29 tells us that our AMH is on the lower side, but it is not necessarily very low. And therefore, another important concept we need to understand here to understand the role of AMH is what we call monthly fecundity. That is, what is your chance of conceiving naturally, all parameters being taken into consideration. So any normal husband and wife, completely normal, young age also has a monthly fecundity of 20 to 25%, which means as a couple we have about at best a 1 in 4 or 1 in 5 chance. Now what this low AMH does is that basically the probability decreases. So rather than a 20 to 25% chance, at a lower AMH we're looking at a slightly lower monthly fecundity, which will probably be somewhere between 12 to 15% here. So obviously you have a decent chance of conceiving every month, but it's just that the probability has gone down. Also, not just the AMH value, there are so many other things that have to be taken into consideration. What is your age? How long have you been trying? Are your cycles regular? Is there any other parameter? Are the husband's report normal? Are the tubes normal? So Actually, we need to individualize and look at everything in toto before we say, okay, what is your individual chance of succeeding naturally, succeeding through IUI, or succeeding even with a treatment like IVF. So the next question Neetu asks is how to increase AMH level at the age of 40. Now that is a big problem that science is trying to face here, because what we need to understand, like I just said, that there is a finite number of eggs that a woman is born with. There are no new eggs ever produced by the ovary, vis-a-vis the males, where every month there is new sperm production or spermatogenesis that is happening. So definitely there are things that we need to work upon. We need to try and increase the ovarian pool, but mostly right now till stem cell or something comes up, we don't have any conclusive treatment for increasing our AMH at 40. Rather than concentrating on repeating AMH levels and seeing if it's getting improved, what we need to focus on is that we have a finite pool, but let's work on improving the egg quality of the limited number of eggs that we have, which means that we should take supplements. There are lots of supplements that are known to help. We have DHEA, we have mild androgens, we have supplements like CoQ10, coenzyme Q10, we have melatonin, and there are a lot of supplements, vitamin C, vitamin E. They've all been proposed that they might increase our chances of conceiving, and therefore those are the things that we should focus on rather than actually being able to improve AMH, for which unfortunately we don't really have a conclusive treatment. So Sinjani asks, I have low AMH, how problematic it is? So it's very similar to what we just said, that it's the probability of conceiving naturally, IUI or IVF per cycle or per month, which is going down. So yes, it is a concern, because it tells us that despite the best of medical treatment, it's not something that we can completely overcome. However, every individual is different, every cycle is different, and therefore we need to plan it accordingly. So the low AMH has to be kept at the back of our mind, that we need to be getting into treatments a little faster than other people. So for example, if there is a 32-year-old girl who comes in and asks me, I've been trying for 6 months, it's not tried out, and all her reports come back normal, her AMH comes back normal, we can easily reassure them and say, okay, just let's take 6 more months and see that maybe it's just chance that it's not working. On the other hand, if there is a person with the same kind of parameters, but the AMH comes low, we then counsel that you have to keep that at the back of your mind and you have to move faster. So maybe see if it's working out naturally 1 or 2 months, not working out, let's move to medications. That's not working, let's consider IUI. That also is not working, maybe move faster to IVF than other people, because the AMH is telling that we have a limited or maybe a smaller window of opportunity compared to other people. So that's all that the low AMH means. So Shweta asks, does AMH and egg quality go hand in hand? Well, scientifically we say that AMH is actually only telling us about the egg quantity. So because it is the number of antral follicles or the pre-antral follicles that are secreting the hormone, so lesser the AMH, then it does mean that the egg quantity is low. The egg quality, unfortunately, there is no science or no test until unless we actually retrieve those eggs through IVF that tells us what the quality is. But there is a dictum that in case we have a patient with a very good antral follicle count or lots of follicles looking up on the ultrasound, but the AMH is lower than expected, then we speculate that maybe there are so many follicles but they're not secreting as much AMH as each follicle should, and therefore the quality may be a problem. But that's not something we can say for substantially be sure about. So Ria asks, what is AMH and why is it important? So as I just mentioned, actually, it is one of our most important fertility tests now, because it tells us how fast we need to move. Is there a problem? A woman may have a good age, absolutely regular cycles, and feels that there's no problem with my ovulation. But it is a test like AMH or other ovarian reserve tests that tell us that no, there may be a problem. There may be an underlying problem to which there are no symptoms. You might have absolutely regular cycles, and the only issue that you're coming up with is that you're having a difficult conceiving. So yes, it's an important test. I've only been talking about the lower reserve of the AMH. Similarly, if you have high AMH, the treatment has to matter differently. You might have regular cycles, but a high AMH tells us that you are somebody who has a predisposition to what we call PCOS or polycystic ovaries. Therefore, you should get mid-cycle, or that is a day 12, day 13 scan in natural cycle to see if you're making eggs normally. Sometimes a woman may be having absolutely regular cycles, not able to conceive, and when you check them mid-cycle, you realize that they're not really ovulating properly or they're ovulating delayed. So those kind of things need to be checked even further if your AMH is on the higher side of normal. So both sides of AMH are very important. So Tripti asks, what is a good AMH level for IVF? So again, there is no, as I said, the normal range is about 2 to 3.5. So if you have a normal AMH, we're happy. In fact, for IVF, even if the AMH is on the lower, on a little bit of the higher side, which means you have a little mild PCO pattern, that's also considered okay, because it means we'll be able to get good number of eggs. But the ideal, yes, is 2 to 3.5, because then we feel that, okay, the quality would also be good. Higher the AMH, more the number of eggs you may get, but you would still need to work upon in terms of PCO, in terms of getting your egg quality right. So, but the minute it starts to go down below 1, and much more when it goes down below 0.5, the AMH starts to trouble you, because your overall IVF success rate also tends to falter a little bit. So Sudha asks, what does high and low AMH mean? So I think I just answered that. So low AMH is when you have an AMH on the lower side of normal, which is less than 2, and it starts to get even more concerning when it's less than 1 nanogram per ml. A high AMH is when it's above 4 or 4.5. So even though a lot of lab ranges would write a normal thing as anything between 0.5 to 6.5, that's actually, in terms of fertility treatment, not taken as the right range, because the minute it starts to get below 2, you start to get worried, and the minute it's above a little on the higher side, you need to evaluate the woman to make sure everything is okay. So Mahima asks, can you still get pregnant with low AMH? Absolutely. So, and it's also the one myth is, or we tend to think that, oh, is it that only I'm going to need an IVF? So that also is not there. The only reason that IVF might be suggested or proposed to you earlier with a low AMH is that because, again, you don't want the AMH to fall down even further, where the IVF success rates would go down. But no matter what the AMH, I mean, there are so many case studies in literature that even show that undetectable AMH, people who have irregular cycles, have also been known to conceive. There are so many patients who might unfortunately have even failed an IVF because of low AMH, and then they conceive in subsequent months. So that also is absolutely alright. So low AMH decreases your probability of success per cycle, but overall that's where it does. Ultimately, it's looking for that and waiting for that one magical egg to come up. Whichever month it comes up, it fertilizes, it gives us a pregnancy, and we are happy. And therefore, no matter what the AMH, you can still get pregnant. Yes, the probability of success goes down, and very, very low AMH or less than 0.5 is when you have to consider options like egg donation if we come to that. So Shreya asks, I am 25 and my AMH is low, can it be improved? So again, Shreya, we need to understand you're very young, and if the AMH has come low, then it is to be taken into account and try to understand why is it so low. So I would be interested in knowing, are your cycles regular? Also, AMH alone is not the only parameter. You need to take into account other ovarian reserve tests. So what is your FSH on day 2, day 3? On your ultrasound, what is your antral follicle count? So AMH at the end of the day is a blood test, and lots of labs can erroneously get it wrong. So if we feel that all your ovarian reserve parameters are showing us AMH on the lower side, then yes, unfortunately we don't, again as I said, have great science to improve it, but we must start working upon it, look at our lifestyles, look at taking more antioxidants and multivitamins and minerals to improve it. However, if the other parameters look okay and AMH is the only lower thing, I would say work upon your supplements and lifestyles for 2 to 3 months and repeat the AMH, and from a different lab and from a good reliable lab, and the AMH might come back okay. So the AMH by itself is just a blood test. Let's not just get wavered by it, but yes, it's an important thing to keep in mind. So Radhika says, when and how can we check AMH levels? Okay, so that's a good question. So Radhika, anybody I would say who's even in the preconception stage or even before the preconception stage, suppose so many of us women are now contemplating postponing pregnancy because of our careers, because of the lack of a good male partner. But it is a good test to do. It can be done any day. It doesn't matter which day of the cycle, preferably post menstrual cycle, but any time actually in the cycle. It'll give you an idea as to how things look. And Even if you're planning that, okay, I am 24 right now, I don't plan to have a baby till 30, it'll be a good idea to just run the test. If it's coming normal, that you're reassured that, okay, so it's fine. But if it comes on the lower side, that's when you need to plan out things. There are even treatment options like egg freezing that are available nowadays, that before our AMH starts to dwindle, before our ovarian reserve starts to go down, how can we protect and preserve our fertility? So that's the next important thing. So again, you can just go and do a blood test, and when can be any day of the month. Pankuri asks, does PCOS affect AMH? So yes, because PCOD means there are lots of small preantral follicles that are not able to grow and ovulate. There are large number of smaller follicles in the ovary than you would expect them to be. By definition also, if on the ultrasound we see more than 12 follicles is when we see in each ovary, we call that PCOS. So yes, because there are larger number of preantral follicles, the AMH tends to be on the higher side. So if your AMH is on the higher side of normal, you need evaluation for PCOS for sure. Trisha asks, what causes low AMH? That's also another good question. Now, unfortunately, there is in 90% of the women, there's no real reason as to why their AMH is low. We don't really know. Maybe there is a genetic predisposition. Unfortunately, we as Indians have a predisposition to lower AMH than other counterparts. So our Western counterparts have a natural menopause around 51, 52. For Indians, as we know, it's usually around 47, 48. So we already have the 3 to 4 year faster decline of the AMH because of that. It could be a premature, a family history of premature menopause, that the menopause comes in early. It could be genetics. It could be the diet, it could be the pollution, it could be the adulterants that we are taking. So we don't know, but what we know for a fact that it is starting to decline faster than you would normally expect. So we see so many patients in our outpatient department, young, just planning and starting out to try with low AMH, and that starts to get worrisome for sure. Coming to the other reasons of AMH, so if somebody has a really low AMH or is going into kind of ovarian failure or very, very decreased ovarian reserve before the age of 30, we would actually evaluate them for some genetic tests. So we have genetic tests known as Fragile X mutation testing. We even have some adrenal reserve testing, adrenal enzyme testing that we do. You have to do a karyotype for some women, but that's the far extreme of normal. So if less than 30, a woman goes into ovarian failure, which is like premature menopause, is when we would do these tests. For other routine women, if it's just a low AMH, the test would usually come back normal. But that's, yes, an important thing to keep in mind. Nisha asked, can stress affect AMH levels? Well, Nisha, we don't have any studies to support that, and probably not. But there is, when we talk about fertility treatment, we always say that yes, let's keep the stress to a little lower side. It does increase the fertility rate if your stress levels are low, but there is no data to support that your stress might lead to a haywire of AMH. Of course, the higher side of AMH, which is the PCOS, in case somebody is taking a lot of stress, is not working out or putting on weight, yes, the AMH will fluctuate because of that. But the lower end of the AMH is actually kind of constitutional or genetic and is not really related to stress. Now, Namita asks, I heard AMH is high in PCOS. Is it true? So yes, I did, answer that question, that when you have an AMH on the high side of normal, you definitely need evaluation for PCOS. So Manika asks, what causes diminished ovarian reserve? So I think I just answered that question, that 90% we don't really know. It's only in 10% of women that we would be running them on certain genetic and chromosomal tests to understand why their ovarian reserves got low, or if there's a very significant history of some kind of chemotherapy or medical treatment or surgery that has been done. But those are rarer causes. For most of the women, 90%, it remains idiopathic, or which means we don't really know why our ovarian reserve is low. Maybe there's some kind of just genetic predisposition to it. Kavita asks, does Clomid improve egg quality? So no. So Clomid is actually a medication which is for induction of ovulation, which means if you have PCOS or some other kind of ovulation disorder because of which the eggs are not forming every day, every month regularly, that's when Clomid is given to push the ovary to out of those follicles to make one big follicle which will ovulate. So, but it really doesn't have much to do with egg quality. Neither Clomid nor letrozole are known to actually increase your risk of miscarriage or birth defects. So no, they don't really have an effect on egg quality. Whether or not they actually help with low AMH is a different issue altogether. So Kritika asks, does AMH change every month? So there would be a small fluctuation that we would be looking at in AMH happening between day to day and between month to month, but they are supposed to be very small fluctuations, and therefore we usually wouldn't even advise doing it very regularly, because unless more than the month, it would be the lab which would matter. So if the lab hasn't measured the AMH well, is a different issue, but month on month the AMH really wouldn't change unless it's on the very lower side of the spectrum where it's starting to fluctuate or decrease too rapidly. So Neeti asked, time to get pregnant since 1 year, when should I take AMH test? So as I said, because we're seeing so much of decreased ovarian reserve coming in commonly, it would be one of the most common tests that I would give to somebody, definitely if they are beyond 30. Less than 30 years of age, we can actually look at the ultrasound. If the antral follicle count, or what we call the AFC, looks okay, we could let the test be for another 6 months. But if on ultrasound or the history, anything suggests that the ovarian reserve might be on the lower side, it's just a simple blood test that should be ordered. As I said, even before you start trying, or even if you're planning to postpone your pregnancy, doing an AMH is an extremely important test to do. So I would run it at a baseline for especially anybody who's beyond 30 years of age. So Vidisha asks, can AMH tests be wrong? So yes, it's important as to which assay the lab is using and which lab that we're doing. So if it's not an accredited lab, yes, the AMH value might fluctuate because not everybody can measure it correctly. But an AMH done from a good, decent lab with standard parameters, the AMH is usually quite a reliable test. But it has to, of course, be taken in conjunction with everything else. What's your age? What's your AMH? How does the ultrasound look? What is your FSH value? And there are lots of other ovarian reserve tests that can be done. And only after that can we conclude that yes, does the AMH seem to be in sync with the other tests, or it seems to be completely fallaciously wrong, that we might as well repeat to see it. So Kuhu asks, what happens if AMH level is high? So AMH level high, as I said, is suggestive of higher little predisposition to PCOS. So we need to work on two things there. One, we need to work on our egg quality. We need to work on taking supplements to improve that. Plus, we need to work on lifestyle modifications, which is weight loss, especially if you have a higher BMI, and exercise, which is very important. Second, if there is no other problem that we see when you're trying to conceive and the AMH is on the higher side, as I said, we would be interested in monitoring you and evaluating you that whether the ovulation is happening okay. If the ovulation is happening bang on time, everything else seems okay, just a high AMH value should not be a big concern. But it would be a wake-up call that yes, let's start getting exercise into our regime for sure, because we have what we call the PCO tendency. But the AMH alone is not a parameter to be worried about too much as far as the PCOS is concerned. So Shraddha asks, does vitamin D increase AMH? So yes, we have studies now that say that the vitamin D deficiency is responsible for poorer oocyte quality that we see in the IVF, or like that's the only time you actually see the egg quality. And therefore, if the vitamin D is deficient and we supplement it, there are studies to show that yes, the overall egg quality improves and the pregnancy rates improves. Does it actually correlate with increasing AMH? There are very few studies to report the data. So as far as vitamin D is concerned, it's a speculation currently that the vitamin D replacement in case of deficiency is going to improve, but we need much more studies to actually substantiate that claim. So Ipsita says, does high AMH cause infertility? So yes, the higher side of AMH, so anything beyond 6 would definitely be looking at PCOS. So as I said, alone AMH does not mean anything, but yes, if there is a high AMH, you need further evaluation. If you're not ovulating well, if there is a problem in folliculometry that we observe on the ultrasound, it is definitely going to need assessment. So AMH on the higher side alone does not mean anything, but if the cycles are irregular, if the ovulation is not happening properly, it does need assessment for sure. So Babita asks, does metformin lower AMH? So Babita, again, whenever you have AMH on the higher side, so metformin number one will not lower your AMH if your AMH is normal. It's just that AMH is a check of that point in time, that do we have good follicles, what is our, how much is the AMH that our follicles are making up here. So yes, if you have PCOS and you're trying to improve that, you lose weight, you take metformin, which gets your insulin resistance better, yes, it may lower the AMH. But again, I would like to reiterate here, we are not interested in monitoring your AMH levels. It has nothing to do with clinical way of how to go forward with fertility treatment. You need a baseline AMH. If it is on the higher side, yes, metformin may have a role, especially if you have high fasting insulin or some kind of pre-diabetic PCOS that you have. But further on, monitoring AMH makes no sense. So theoretically, yes, if metformin will improve the PCOS, the way weight loss will improve the PCOS, the next time you do your AMH, the AMH will come back to be on the little more normal side of the AMH. But AMH monitoring has absolutely no role in clinical fertility. So Shrishti asks, I'm taking contraceptive pills from past 3 years. Will that affect my AMH level? Again, I'd like to reiterate here, these are not conditions where we would monitor your AMH. So because theoretically AMH is because of the follicles and preantral follicles that you have, and oral contraceptive pills are suppressing the ovulation, they can lead to a little less number of follicles being recruited, and therefore your AMH might come back low. So, but those are not situations where AMH has to be monitored. Taking contraceptive pills is very safe because you're not getting ovulation happening. So your reserve is going to be the same as it was. The decline will be the same as it was. But the oral contraceptive pills are not going to be responsible for any kind of lowering your AMH or you going into decreased ovarian reserve. So there's no data to tell us that. So Ashwini asks, which is more important, AMH or FSH? So that's another important question. Now, again, when we're talking about decreased ovarian reserve, that the number of follicles that we have in the ovary are coming down, there will be the first stage where there are no symptoms. This woman has absolutely regular cycles. She just comes in for a check. We do their FSH and AMH. FSH importantly has to be done on the second, third day of the cycle, otherwise it has no meaning. So if the FSH and AMH have been done, the AMH comes back on the lower side of normal, but the FSH remains normal, because that is a test that will come back starting to get abnormal much later on. So your FSH and AMH coming normal, great. The second level of decreased ovarian reserve is that the FSH remains normal, or maybe the higher side of normal. It might be between 8 to 10, but the AMH has started to decline and the woman has absolutely regular cycles. The next stage is that the cycles might start to get shorter. Instead of 30-day, you might start having a 25-26-day cycle. And importantly, the FSH now starts to rise a little bit and the AMH is going down further. The last end of the spectrum is when the FSH starts to rise. So it rises above 10 to 11 and the AMH is still on the lower side and it's getting even lower. So answering your question, which is more important, AMH and FSH, they both have their important roles to play. But the AMH is the first test that will catch a decreasing ovarian reserve by the time the FSH is still normal. But the minute the FSH starts to rise, it starts to get even more worrisome because it tells us you're at the later stage of decreased ovarian reserve. So each test has its own relevance. But to answer your question, initial part of decreasing ovarian reserve, AMH is the most sensitive parameter. FSH might be fallaciously appear completely normal to us when AMH is the only test that will come back on the lower side. So Monica asks, what does Anti-Mullerian hormone do? So Monica, the Anti-Mullerian hormone is just a normal hormone. There are so many hormones that are circulating in our body. It is just that over a period of time with research, we have understood that these tests correlate with fertility and these do not. So the Anti-Mullerian hormone is actually required in male fetuses at the intrauterine time to prevent the female genital system from developing. So that has nothing to do with what we are discussing right now. Overall, the AMH has little role to play, but it's an important hormone for us to measure that, okay, this is a test that's going to depict us as to what is the woman's fertility currently and what is her ovarian reserve currently. So Sheena asks, what foods increase anti-Mullerian hormones? So that's good. So we have to focus on taking more antioxidant rich foods. So we have to take things like walnuts, almonds, flax seeds. We have green vegetables, we have pomegranate, we have tomatoes. They're all antioxidant rich foods. We can take that to help improve our anti-Mullerian hormone. Ritu asks, can AMH test be done during periods? Yes, Ritu, it's actually one of the best times to do it. So second, third day is the best time to do an AMH. But unlike the FSH, which has relevance only on the second, third day, the AMH can be done actually any time of the cycle, because our studies have shown us that there's very little fluctuation throughout the month, and therefore it can definitely be done at that time. So Reena says, how can I check my egg count? Well, you need to get an ultrasound done, and there's an entity known as antral follicle count, or that's the AFC, where the radiologist or your doctor would measure how many follicles can be seen in the ovary. That in conjunction with AMH. So the AMH and the AFC together give us a decent idea of what we think your ovarian reserve is like. Preeti asks, how many eggs does a woman lose during her period? Right. So we have a finite pool. Out of that pool, there will be a proportion of eggs. So it's actually typically around 8 to 10 follicles that will start to grow every month. And no matter what you do, whether you take medications, you don't take medications, there's actually only one follicle that will continue to grow. The other 8 to 10 undergo atresia. And therefore, every month on month, these follicles are going to go down, and that's how the ovarian pool goes down. So Radha says, I get my periods every 15 days. Will that affect my egg count? So Radha, it's actually the other way around. So it's not that every 15 days, if you get your periods, your follicles are going to go down rapidly. It's not like that. So for everybody, you have a menstrual cycle. A regular menstrual cycle will mean there'll be a phase of period, then there'll be a proliferative phase where the egg develops. Then if there is no pregnancy, there is a luteal phase where the hormones go down, and then there is a period. So for anybody having regular cycles, it's usually a 28 to 32 day cycle that this is supposed to repeat. Now, if you get your cycles every 15 days, it does not mean your pool is going down faster. Rather, if you're having what we call polymenorrhea, cycles every 15 days, you actually require a whole hormonal assessment to understand why that's happening. It could be extremes of the problem, could be because of low AMH, you're not regularly making eggs, and that's why you're getting your cycles every 15 days. On the other hand, it could be the other spectrum where you have PCOS, and because of hormonal imbalance, you're getting your cycles every 15 days. But that has nothing to do with the ovarian reserve pool, but it's a sign of hormonal imbalance which needs to be evaluated. Garima says, I have obesity and currently I am 25. How soon I should go for the AMH test? We are planning now to get pregnant. So Garima, it's not just important as to what your age is, your cycle regularity is also very important. So I would say you need an assessment of hormones. AMH would be one of the panel, but there are other hormone tests that you need to do along with an ultrasound scan. And if your cycles are irregular with a higher BMI, you might have a higher AMH and a PCOS tendency, and your treatment would therefore go differently. However, if you just do a baseline scan that also says PCOS and you're making eggs regularly, you're not somebody who has to jump into getting an AMH done very quickly. You could just do the other hormones also. But you have to evaluate yourself, more important than AMH, as to whether your egg development is happening normally. So what we call the folliculometry on the ultrasound is very important, where we do the ultrasound serially between day 10 to day 18 of cycle to see if your egg development is normal. If you're making eggs normally, just don't be bothered about it. You're not somebody who requires an AMH right now, maybe not till 6 months. But if there is a problem in any of them, yes, a whole hormonal assessment would definitely need to be done. So Dhruvi asks, what information does the Anti-Mullerian hormone test provide? So basically the ovarian reserve. So the Anti-Mullerian hormone test tells us that whether we have, how does our ovarian functions look in terms of fertility. And kind of the AMH is only relevant in terms of fertility because otherwise we don't really do the test. So if it's on the lower side of normal, yes, we need to work upon faster, our egg reserve is going down, age is catching up, and we need to get pregnant quickly. If the AMH is on the higher side, then we have a PCOS tendency and we need to work upon that big time. So Anjali asks, does the AMH tell me anything about my chances to get pregnant right now? So as I said, it's just a monthly probability. So the best of probabilities is about 25%. If your AMH is on the lower or the higher side of spectrum, your overall chance or probability is going down. But for a particular person, it's going to be either 0 or 100, so it means nothing. So an AMH in isolation means nothing. It's just that we have to be careful about it. It's an important test to do to make sure you're not losing out time. See, what happens a lot of times is you start to plan at 30, 31, and you just keep seeing, okay, whether it's happening or not. You're just getting into basic treatments. But that's where the AMH test is very, very important because it tells us, okay, how fast should I, rapidly should I move? There'll be patients who have unexplained infertility. Absolutely no reason. that's where the AMH is a very important differentiating factor. If the AMH is normal, it's alright. We can give it some time and see. If the AMH is on the lower side, you have to start to hurry up. You even have to consider options like IVF if things do not work out quickly. And that's where AMH, that's all. So it just is a guiding force for us. How quickly should we get into fertility treatment? What are my probability chances every month? That's all that the AMH tells us. So Kanika asks, I'm planning a second baby at the age of 33 and during my first baby my AMH was low. Should I be worried? Yes Kanika, I would definitely repeat the AMH. If with the first baby our AMH was on the lower side, you've been lucky, we've had a pregnancy, so that's great. So let's repeat the AMH. We have in fact a trend with us. We know that, okay, 2-3 years ago, whenever we had our child, this was our AMH. What is our AMH level now? And that will set the footing for how quickly we should be even planning treatment. Shilpa says, does AMH affect my cycle? So AMH, extremes of AMH would start affecting your cycles. As I said, if your cycles start to get irregular, whether they are short or whether they are prolonged, the extremes of AMH do that. So if your AMH is like way irregular, way low, starts to get less than 0.5, that's when usually your symptoms start to come up in terms of irregular cycles. That's because there are very less follicles. On the other hand, if you have a high AMH, it's showing that you have PCOS, because of which you might have either very short cycles or delayed cycles. So it's not that AMH affects it. AMH is just telling us the reason behind the irregularity. The reason, of course, lying with the ovary. AMH is just a measure of that. So what are the options if my AMH is on the lower side is what Purva is asking us. So AMH on the lower side, as I said, does not mean you need to jump into IVF. It just means that you have to think quicker. Again, your all other reports, your age, AMH, what are the parameters we have. See, suppose there is a patient who has some tubal factor where we're not very sure how the tubes are. The AMH is again a very important guiding factor. So if you have a tubal block with a normal AMH, your options are you can get into a hysterolaparoscopy, you can get a laparoscopic evaluation of the tubes and decide what to do. On the other hand, another patient with blocked tubes but low AMH, it would be advisable rather than wasting time for a laparoscopy to go straight into IVF, because let's preserve whatever pool we have and quickly use it in IVF. So there is nothing like there is no other specific treatment options unless the AMH is too low, the FSH has started to rise. That's when egg donation, etc. has to be considered. But AMH on the lower side simply means let's do treatment quicker. Let's first try with medications, not working. Let's move to IUI, not working. Let's move to IVF without wasting time is the important dictum. We don't want you coming back after 1 or 2 years and saying, oh, I tried, it did not happen. Now I've come reconciled to IVF. Unfortunately, by that time the AMH has gone down even further. Your percentage chance of success at IVF has also gone down. So time is of big essence when your AMH is low. And there is no definite to do treatment or that only IVF will work, nothing like that. But if smaller treatments are not working, you should not waste time. It's the basic dictum of low AMH, nothing else. So Aditi asks, when is the best time in the cycle to test AMH levels? A best time would be post-menstrual, which is day 2 to day 5 of cycle. However, if you don't want to wait that long or there are some other tests that you're doing, the AMH can actually be done any day of the month. But the most preferred is post-menstrual. Mansi says, should women considering egg freezing undergo AMH testing? I would say yes, it would be a good prognostic tool as to what we think are your chances, how is your pool, and therefore for you to know what are the number of eggs that we can expect and what is the quality of eggs that we can expect. So it can be done, it may not be done. If somebody has decided to go for egg freezing, yes, you do it. But if, you may or may not do it. But if there's somebody who's just contemplating, is egg freezing important for me? Again, all these hormone tests of FSH and AMH are very, very important because they would give you a realistic idea of how much egg reserve you have left in you, and therefore to actually consider egg freezing if you've not been thinking about it so far. Pratiksha asks, how can I improve my egg quality naturally? So yes, we need to work upon our lifestyle. So things like yoga, people do things like acupressure, acupuncture. Acupuncture has been medical evidence-wise shown that it does improve the AMH or the egg quality. You need to start taking antioxidants like I've discussed earlier. You need to focus on yoga, exercise, losing weight, de-stressing your body, meditation. All those things would have their own small impact on the egg quality for sure. So the next question is, Vishaka says, what vitamins improve egg quality? So again, as far as the vitamins are concerned, we have vitamin C, vitamin E, we have coenzyme Q10, lycopene, L-arginine, DHEA, we have mild androgens that are coming in. So all these things are given in our attempts to improve egg quality. So it's actually kind of a cocktail regime. Some give some doses, some give other doses, and something might work. So these are things that we need to take. So Janki says, how can I boost my ovulation naturally? So Janki, again, it's important to see what is the problem. Do you really have an ovulation disorder or not? So if you are ovulating normally, that's great. You just need to work upon your egg quality bit. If your AMH or your ovulation disorders are there, we need to work on it either way. So how to boost the ovulation naturally? We have to keep in mind, do ultrasounds if possible, focus on our diet and exercise that we just mentioned, and try and just say that it's fine, I'm doing my best and let's see how it works, because fertility will take time. So patience is also a big key over here. So Harshi said, I read there are different normal levels for different age. Is it true? So definitely, I mean, AMH, as we said, is a sign of your ovarian reserve. So what your ovarian reserve is normal for the 20s or at 20 would be different at 25 and then at 30, 35. So there would be a thing in our mind that yes, when we're talking about 2 to 3.5, we're saying that's kind of the normal for somebody who's less than 35. But somebody who is above 35, if they have an AMH of 1.8, we would say, yeah, that's kind of normal for your age. If it's lower than that, then you would be worried. So yes, it is age specific, but it's always a range. There is never a specific value which we would say is normal. But when it starts to go down for anybody, despite their age less than 1, is when you start to get bothered. Also, there are two different levels. So there's a nanogram per ml and there's a picomole per liter. So we have to be very careful which range is being mentioned, and accordingly the normal normograms are brought into being. So therefore, this is what I would importantly want to highlight about the AMH levels. It is important. One of the most important things that we need to keep in mind that AMH alone does not tell us what treatment is it that we are looking at. Importantly, it just tells us that, okay, how much time do I have? Do I have the time where I should just let it be? If the AMH is on the lower side, we're actually more bothered, we're more concerned, because a low AMH means that your ovarian reserve is depleting, for which unfortunately till now we do not have any great solutions, unless it's like an extreme and you're looking at egg donation options. The higher side of AMH is still alright. It's a sign of hormonal imbalance. There are lots of lifestyle modifications and lots of medical treatments that can help us conceive. But it's the lower side of AMH where we need to very clearly understand it's not a big sign of worry. It's just that, so we don't need to jump into treatments, but yes, we need to keep into our mind that yes, I have a little lesser time than other people. I start taking supplements, I try to improve. IVF would be the last option, of course, where it would help that in case we have a finite number of pool, let's at least get the eggs out, get a basic embryo selection that, okay, these are the good embryos, we transfer, and that helps us in getting pregnant faster. So the only way IUI and IVF would help in low AMH is that they would shorten your journey. It will help you to get pregnant faster. There is nothing like you cannot conceive naturally. It's just that because your probability of success is starting to go down, you're somebody who has to consider these options a little earlier than other people. Somebody who is young, somebody who has a normal ovarian reserve, has the kind of time to try other options and say, it's okay, let me see if things are not working out. If it doesn't work out, I'll think about that. But somebody with a low AMH, you start to get bothered. You say, let's do an IVF at the right time, because time is of essence. If we come back after 1 or 2 years when the AMH has gone down even further, that will bring down your IVF success rate also from a good 60-65% down to 25-30%. And therefore, doing the IVF in a well-timed manner or when our ovarian reserve is good is extremely important, so that we don't have to consider options like egg donation, which we would not want to discuss otherwise. So I wish you all the best, and I hope this has been a little bit of given you a little insight on how AMH is important. It in itself doesn't mean anything. Its monitoring is not important. We don't need to keep doing the FSH and AMH again just to see. even if it's coming on the lower side, it just tells you that's how the trend is set. Let's try to get pregnant faster. Somebody who does a preconceptional report and has a low AMH is somebody who should say, okay, let me see if my career can take a backseat and try and get pregnant quickly. And if yes, natural conception is not happening, then somebody with a lower AMH is somebody who needs to start getting into active medical treatment faster and quicker, because that is of essence. We get a lot of patients coming back who repent the fact that they did not understand the importance of AMH, and I'm just trying to hope that by this kind of an outreach, more women understand the importance of AMH for their fertility and therefore take treatments and their decisions accordingly. I wish you all the best, and I hope this has been helpful. Thank you very much.